Hi everyone. I hope everyone's having a good start to their week. Today I am going to be discussing advocacy and the importance of advocacy. I know that I've already touched on this topic, I think, last semester, but I've been working a lot with some advocates through the state of Maine and New Hampshire in regards to some of the long-term care patients that we have in the facility at the moment. Just a little quick refresh. I'm on doing my field experience on the geropsych floor at the hospital that I currently work. And in this particular unit, we deal with individuals over the age of 65 who have Alzheimer's, dementia, mood disorders, that type of thing. Sometimes these patients are here for a lot longer than your regular acute care setting, which means that they can be up to, right now, the longest patient that I have here has been here for almost 4 months. And this is the particular patient I'd like to talk about today. She is an individual who is living on her own for 17 years previous, and she has a mood disorder as well as some depression. She grew up in a family where she was constantly put down all the time, did not have a very loving, supportive environment. And she's currently 87 years old at the moment, and you can see how that long-term behavior has affected her up into her life at this point. She has what we like to call tantrums here. She is very particular in how her things are done, very particular in her order of things, and she tends to get a little distraught or upset. They use the term hysterical here quite a bit with her in regards to whether something has been moved or just not her typical normal routine. And that has caused some issues with her in regards for us finding placement, because it has been deemed that she is not able to continue living on her own anymore. She was not taking care of herself properly, wasn't eating, and she's a very small woman to begin with. So this was some concern for her niece, as well as for her male friend who helps to take care of her as well. So we have exhausted all opportunities throughout the state of Maine in regards to her, and they've all basically been denying her, mostly due to what they term her behavior. She really does not have any behaviors. It's just that she raises her voice and she kind of yells a little bit. No aggressive behavior towards anyone else or any of the other patients on the unit. It's just that she likes her space and she likes the way things are. And she's also very good about removing herself from the situation, where she'll go to her room and she'll calm herself down. Other than that, she's a very social individual. She loves to sit in the common room and have conversations with patients. If there's a patient in there who is lower functioning than she is, she kind of takes on that motherly nurturing role and tries to help them or to do whatever for them. She truly does enjoy that. So she has what they call Maine Care. It's similar. It's Medicaid basically. And in the state of Maine, they have to have what they call a Gould assessment, where a state nurse comes in and assesses the level of care for this individual patient to determine whether they need to go to a long-term care facility, assisted living, residential care, that type of thing. So we have been working tirelessly on her. My field supervisor has files and files on regards to this one particular patient. And it's been about a month now that we have gotten her hooked up with a private case manager, as well as dealing with our social worker here. So there's multiple people working on her case and advocating for her and trying to find her an appropriate place. The one place that she had gotten accepted at, they declined her at the last minute due to another patient that they had that had behaviors, which kind of, if you think about it, really isn't fair to deny her on the behaviors of another patient because they seem similar. So she has this advocate that actually her Medicare pays for, which is wonderful. I think it's $84 a day that goes towards this particular case manager. So she's also been out looking through all of the different facilities in Maine trying to find her some placement. We have also gone into the mental health system in Maine because we thought that maybe they could help us there in regards to finding a placement for her. and that hasn't really panned out so well. But what we did find is OMS, which is the Office of Main Care Services, they have an advocacy department, this was very interesting for us because we'd never even heard of it, for complex cases such as this. So the particular facility that has denied this individual is now under new management. So we're going to try and have her placed there again. So this case manager for the state of Maine is calling this facility, as well as her advocate and private case manager, as well as us, getting in touch. And it kind of sort of panned out a little bit. She has a new interview and evaluation coming up on the 23rd. So that's promising. We're hoping to get her in there because she is one of the higher functioning patients on our floor, and she is one that does well in social situations. She's actually has lived in Maine her whole entire life, and in the county that she lived in, she's gotten Citizen of the Year several times. So she really enjoys being around people. It's just a matter of these facilities are scared to take these patients that they call behavioral patients. And like I said, she has no aggressive behavior. So it's been very interesting to watch this whole process and watch all of these people come together to try and do what's best for this patient. She's been in the hospital for almost 4 months now. She's getting frustrated with that, which nobody can blame her. This is a locked unit. They're not allowed to go outside. They can't just, they can wander the unit, but they can't. That's as far as they can go. So she's looking forward to getting out. In this particular facility, she will be able to walk outside and to, join group activities and do whatnot. So it'll be a benefit for her. But I found that having all of these people working together and working for her has been absolutely wonderful to watch, because you particularly don't see, at least I haven't recently, see anybody push for these particular patients. Unfortunately, the geriatric population is growing, and the amount of folks that have dementia and Alzheimer's and behavioral disorders and whatnot, there really is no place for them because individuals are scared to take them on, and I completely understand that. But there's just not enough facilities for these individuals, especially in the state of Maine. New Hampshire's a little bit different. We do have some, but a lot of our facilities that we used to refer out to that have these memory care units that are locked units are now no longer locked units. So they're not accepting these particular patients anymore. And that's where we have this long layover where these patients that are stable have been sitting in the hospital for a long period of time, and sometimes the milieu on the unit is not conducive for them staying here. It tends to agitate more because there are patients that have come in that are sicker than most, and we're trying to adjust meds and making sure that the ones that are stable are having a safe healthy day. So it's kind of, the longer they're here, the more it tends to disrupt them. So it's kind of like the second they start stabilizing and getting better, we need to have them be discharged so that the behaviors don't happen again. But with this particular individual and having all of these advocates for her, there's finally a light at the tunnel. I don't know if it's at the end of the tunnel, and I'm not sure if this particular facility will take her after all of this has happened. But she doesn't qualify for anything else, so it makes it very difficult. So it's you have these people who are advocating for this patient that is kind of stuck in limbo, where the mental health system won't help her, and these nursing facilities won't help her. What else is she supposed to do? She's not safe to be at home by herself due to her age and her frailty, unfortunately. She needs supervision, not 24 hours a day, but she needs something, and she needs to be in a social environment, which is where she seems to be thriving. So that is our hope for her. So hopefully next week I will have some good news in regards to her and how hopefully we can get her transitioned from the hospital to her new home. which is something that she's extremely looking forward to. I'm sorry if this light, I'm actually at my rotation today on my lunch break, so I figured I would do this today, and this room is very bright, so I'm sorry if you can't see me. But so yeah, I've been able to witness some advocacy in action here, which has been wonderful, and to actually find out that Maine has an advocacy department for these type of complex care patients, from whether they be geriatric, pediatric, whatever. That's what they're there for. So it was nice to know that. So I'm on the hunt to see if the state of New Hampshire has anything similar like that to help with any of our New Hampshire cases that we do have. So I hope that you're all having a great week, and I will talk to you soon.